A pre-procedure ultrasound of this femoral nerve area is performed. A horizontal skin infiltration is done with 1% lidocaine using a 25-gauge needle. The skin is prepared with antiseptic solution and draped in the usual fashion. The probe is covered with sterile gel and a probe cover. This video will demonstrate the use of aerostimucath. You will need 5% dextrose for distending the perineural space. The catheter is removed from the pouch and kept in a sterile towel closer to the block site. The needle is assembled with 10 mL of sterile 5% dextrose as a distending fluid. The nerve stimulator is set to deliver 0.6 milliamps of current. A small amount of ultrasound sterile gel is applied on the area to be scanned. The probe is positioned horizontally with the notch facing laterally. The probe is moved medially or laterally until the nerve is positioned in the middle of the screen. A local puncture of the skin is made at the midpoint of the probe on its caudate surface. The block needle is inserted at about a 60-degree angle to the probe. One will see the tissue movement as the needle enters the subcutaneous tissue. Angling of the needle medial to lateral can be made at this point to aim at the femoral nerve. As the nerve reaches the iliacus fascia, there will be increased resistance to insertion, and one can see the downward tenting of the fascia iliaca. As soon as the fascia is entered, one can see the contractions of the quadriceps muscle when the nerve stimulator is turned on. The needle is seen as a bright hyperechoic dot. A small amount of 5% dextrose injected in this location highlights the femoral nerve as a hyperechoic shadow. The extension tubing is removed, and the stimulating catheter is advanced an additional 5 centimeters beyond the tip of the needle while maintaining the quadriceps contractions. This will require gradual rotation of the needle to accomplish. Injection of agitated 5% dextrose is seen as a medley of colors closer to the nerve with the color Doppler. The catheter is tunneled and dressed with an occlusive dressing. If the needle tip is inserted too far into the iliacus, one may visualize the needle tip with a small amount of dextrose or during withdrawal.